In this video, I'll be talking about vitamin D, one of the fat-soluble vitamins. Vitamin D has many functions in our body, such as increasing the absorption of calcium and phosphate in the intestines. It is also involved in bone remodeling, that is, bone mineralization and resorption, and it plays an important role in the nervous, muscular, and immune systems. Deficiency of this vitamin can lead to rickets in children and osteomalacia in adults, a condition where your bones are weak and soft. It can also lead to osteopenia, which is a condition where your bones have lower levels of calcium, which can eventually lead to osteoporosis, where your bones can fracture more easily. Some of the symptoms of vitamin D deficiency are muscle weakness, pain and cramps, fatigue, bone and joint pain, and mood changes such as depression. What are some sources of vitamin D to prevent deficiency? We can find vitamin D in egg yolks, liver, fatty fish such as salmon, tuna, fortified milk, fortified margarine, and fortified orange juice. We can also get vitamin D through the skin when exposure to sunlight. In some cases, people may need vitamin D supplementation. It is important to mention that the excessive intake of vitamin D may lead to toxic levels. Vitamin D toxicity may lead to buildup of calcium in your blood, also known as hypercalcemia, which can cause nausea, vomiting, weakness, and frequent urination. Vitamin D toxicity may progress to bone pain and kidney problems such as kidney stones formation. Now I would like to mention some of the causes that may lead to vitamin D deficiency. Malabsorptive conditions such as celiac disease, where the intestines cannot absorb enough vitamin D. People who have undergone weight loss surgery such as bariatric surgery or gastric bypass, where the shortage of the intestines and or the stomach do not allow for proper absorption of certain nutrients, minerals, and vitamins. Obesity, since this vitamin is stored in fatty tissue and is isolated here, leading to a decreased availability for other tissues. Liver or kidney problems. There's an enzyme found in these organs that converts vitamin D to a form that is used in the body. Lack of mobility. People who are homebound or who rarely go outside, for instance, those who live in nursing homes, may not use sun exposure as a source of vitamin D. When talking about skin color, those who have dark skin color are less capable of producing vitamin D when exposed to the sun as compared to those who have fair-colored skin. And finally, those infants who are being breastfed exclusively are at higher risk of developing vitamin D deficiency, since breast milk only has small amounts of vitamin D. Thank you for taking your time to watch this short video about vitamin D. Stay tuned for the next video where I'll be talking about vitamin E.